Hi, welcome to MVP training. We've got Heath here. He's our trainer here at John Carroll Catholic. He's going to tell you a little bit about what he does and who he works for. And then we're going to walk you through a couple of injuries that I've been seeing in the weight room and some more information that he has for us. So Heath, tell us about yourself.
I'm Heath Ross. I work for UAB Sports Medicine, Children's of Alabama, and I'm a certified athletic trainer, and I provide daily outreach services to athletes in John Carroll, whether that be prevention, management, or treatment of athletic injuries.
Okay. The reason why I have him in here is because the relationship between the strength coach and the trainer has to be such where I've got to get a lot of information from him. I want to try to keep the athletes out of this training room, so our relationship has to be really tight and we have to communicate really well. So that's why I'm bringing him to you today, and some of the injuries that I've been seeing in the weight room and some weaknesses that I've been seeing. We've been talking about some hip flexor problems with kids having issues getting their knees up, and we're going to talk about some of the muscles involved with that and some of the things that we can do to strengthen those areas. So you got to take it away.
Yeah, like Coach Barron said here, a lot of hip flexor injuries can be attributed to a number of different things, and we see them a lot at the high school level. A few of the causes could be from weakness of the hip flexor itself, along with tightness, or weakness in the core muscles surrounding the hip flexor, or even tightness in the opposing muscles, such as the hamstring and the glutes. So, first and foremost, whenever we have a hip flexor injury, we have to kind of figure out what the main cause of that injury is, and then we can kind of work on treating it after we get that information. So we got Jalen here today who's going to be our model for us. First of all, I'm just going to go through a couple of tests that we do to test for hip flexor tightness, as well as hamstring tightness and possibly some core weakness. Okay. So first of all, the test for hip flexor tightness, I will get Jalen on the edge of the table here, so Jalen just slide forward to the edge here for me. Then I'm going to have him lean all the way back, all the way against the table. Bring both knees to his chest, and grab up his left hand. And then if I'm going to test his right hip flexor, I'm going to let him release this leg, let it fall down here. And what we're looking for here is, if this hip doesn't extend all the way, then he's probably got tightness at the hip flexors. Now, if it extends all the way, which he's got pretty good extension here, and he has less than 45 degrees of flexion at the knee, then he's probably got a tight quad muscle. So we have to address that as well. So that's one of the tests that we'll use to look for hip flexor tightness. All right, gentlemen, the next test we're going to do is just slide back and back just a little further on the table. We're just going to test his hamstring flexibility here. So to test that, I'm going to have him bring both knees up about 90 degrees. Grab back behind the knees here, gentlemen. All right. And then the test for the right leg, we'll have him extend his leg up. And we're looking at the angle of the hip here. Okay, if this leg was not able to extend almost straight or less than a 20-degree bend, then he's probably got hamstring tightness. Okay. And like I said earlier, if you got hamstring tightness, those hip flexors have to work harder during motion to overcome the lack of flexibility of the hamstring. So, all right, Jalen, and the last test, I'm going to have him roll over on his stomach. Just have your head this in so our camera can get a better look. And I'm going to get your arms in kind of a push-up position here. Just slide back. Jalen's pretty tall here. And what I'm going to have you do is try to go into a regular push-up. And what I want to look for here as the person assessing is if his shoulders come off the table at the same time as his hips. Okay? If his shoulders come off before the hips, then he's probably got a lagging core, which is a little bit weak. Okay? So I'll have you squeeze your quads really tight and push up and push up. So you see there, Jalen came up pretty fluid motion there, so he's probably got pretty good core strength. All right, Jalen, that's good. So those are some of the tests that we'll look at to assess for hip flexor injuries, what might be the cause.
Good. Like we said before, Jalen's been a good sport here. I just pulled him in off the parking lot. He's an outgoing safety. Where are you going to school today? Jackson State University. He was a great football player for us, and he did well for us today as well. things that I see in here are related to range of motion. When I hear that coaches don't, in the weight room, that they have problems with some of the injuries that they see, it's because that they're not training the range of motion in the weight room. A lot of strength coaches like to train the movements on the field, but I believe in order to keep them out of this training room here, you got to go a little bit beyond that. You got to train for the stuff that the stuff that you can't really for lack of a better word, can't really all put it together, and athletes get put in all kinds of bends and different range of motions. So you have to help them out with the strength in the range of motion. It's not just range of motion, it's how strong they are in those vulnerable areas. So what Heath is going to tell you a little bit about is the relationship between injuries and range of motion, and some of the things that we can do to correct that. And we talked about the hip flexor. We see a lot of problems with the hamstring, the glute hams, and the lower back. So there's a lot of issues right here with the core. Again, it's the same stuff that we went over. So Heath, tell us just a little bit about range of motion and some of the injuries that might come in because of lack of.
Yeah, like we went over earlier when I was testing Jalen's hamstrings and hip flexors. If you notice the lack of range of motion there, it should be, there's a limit that's not within the normal range of motion that you would see. That can predispose you to an injury when you're out there in normal running or sprinting, any kind of or soccer movement, for example. If you don't have the proper range of motion, then those muscles are either going to give out or going to have to work hard, and you're going to get a chronic type of strain. So, in other words, to sum all that up, we'll have, after we do that assessment and we find a limited range of motion, I'll take the athlete through some stretches to kind of, over time, regain the range of motion that they need. So, Jalen's going to be our model here again. So, for instance, if Jalen had a tight hamstring muscle, which was the last test that, for the one right before the push-up that we tested him on, if he had tight hamstrings, I would get him in a seated position, just face this way, Jalen, and let's stop there just a little bit. And we're this right leg hang off. This will be a stretch for his left hamstring. So what he'll do is he'll squeeze this quadricep muscle real good tight to keep the knee good straight. He'll sit up good and tall. He's going to lean forward at the hip joint. And he doesn't have to touch his toes or get to a certain point. As long as he's feeling stretch in the back of his leg, that's elongating those hamstring fibers, okay? And hopefully the idea over time is to lengthen that to where when he's in a fluid running motion, he's not getting opposition on those muscles. Another one would be on the opposite of the hamstrings, the hip flexor itself. So if Jalen had a tight hip flexor that we assessed earlier, I'll get him in an even position to stretch that. And if we were wanting to stretch his left hip flexor, I'd have him bring his right foot up. Okay? And what I want him to do first, since one of our hip flexor muscles originates from the spine, is I'm going to have him do a pelvic tilt to try to rotate his hips back toward the spine. You can see through his belt here, he's rotating that belly button back toward the spine. And what that does is already puts the hip flexor on tension. Once that's good and tight, I'll have him shift his hips forward and feel even more of a stretch right through the hip flexor here. And then thirdly, to get even more of a stretch, I'll have him reach the same side arm to the sky. He's getting a stretch all the way through the torso here, through the hip flexor range, okay? So that would be a good stretch for the hip flexors. Variation of that to get more of the adductors and the groin would just be simply to shift to more of a diagonal motion, okay? Just play with different angles there to get centered onto the area of the muscle you want to stretch. Now for strengthening, the core, we talked about the test for the core. If I want to do some core strengthening, I always start out with the athlete in a supine position and basically just have them do a pelvic tilt. I want to come over here with the camera a little bit. Sorry. So So what I want Jalen to focus on is to flatten out that curvature of the low back here, okay? And to do that, he's got to tighten these ab muscles and basically drive his belly button down into his spine. So what I try to tell patients is either drive the belly button down the spine or pretend there's a string from your chest to your belt. You want to shorten that string. So he's got to rotate here and tighten up. He'll hold that there and relax. Okay, so you see that hip kind of rotate. So we'll have an athlete do sets of 10 up to 30 of these to try to work on tightening there. Once they can get the grasp of that, I'll have them work on incorporating the hip flexor with it. So I'll have them do a pelvic tilt, and I'll have him just bend his knee up, slide his knee back. So he's working on keeping this good and tight while he's activating his hip flexor. Then back down, and then you just graduate from there. Have him bend this leg up for support. Do the pelvic tilt to keep this leg straight. Do straight leg raise, okay? A little bit harder that way because you got more torque there, okay? So that's just one of the hip flexor strengthening the shoulder.
The reason why we're talking about hip flexors is because it's so hard to train in the weight room. It's very easy to forget about it because as an athlete, you want to work on hip extension, not hip flexion. You got cleans, you got triple extension snatches, you've got all kinds of things that you can do for hip extension, but not hip flexion, unless you're doing a lot of sprinting mechanic work or doing wall runs or doing stuff like that. But there is some things that you can do to help you out, just like he said. So I appreciate you guys, and maybe one day you can come back after being in Jackson State and help us out again. Thanks.